Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on COVID-19 for the week ending January 7th, 2021. As with all of you, I'm deeply upset by the events of the last couple of days. I'm discouraged, I'm sad, I'm frankly a little angry. In part because I realize that it represents how big a hill we have to climb as a nation in terms of politics, in terms of social programs, in terms of this pandemic that we're talking about. Hopefully we can set aside our differences and recognize that there are so many issues that we need to work on together so that we can take all of the strength, all of the energy, all of the enthusiasm that we have as a nation and focus on the issues that we need to deal with. In terms of the pandemic, globally, there have been 1.9 million deaths, rapidly approaching 2 million, almost 90 million confirmed cases. In the past week, it was a 4.3% week-to-week increase. We follow this week-to-week increase because this tells us whether the pandemic is speeding up or slowing down. You'll recall that in September and October, it was about 3.5% week to week. It then increased to about 5%, and now it seems to be coming back down. And while 4.3 is better than 5, even at that rate, we would expect the number of deaths worldwide to double in less than 4 months. Globally, we've seen this pattern where there was a rapid rise in deaths in the springtime, a slight increase in the summer, and then this rather large increase. And while it appears to be leveling off, I don't think anyone should take any solace from that because, again, the pattern has not suggested that it's going to be coming down. In terms of where the diseases are occurring, the cases and the deaths are occurring early on. They were in China, followed by Europe, then over the summer, largely in the Americas, but now a second wave occurring in Europe and still in the Americas. In terms of the countries in the world that are the most heavily impacted, here are the top 20. Again, pink is South America, blue is North America, white is Europe. The United States is there in 7th place. And just to remind you, 1,000 deaths per million means 1 out of every 1,000 people has died already from COVID-19. We've been following this pattern in Europe where there was a spike in deaths in the springtime, relatively few deaths over the summer, and then a second spike. Not every country is showing the same pattern, but it appears to have this pattern in Belgium and Italy. England, we thought was starting to do it, but now it looks like it may be picking up again. Whether that's due to this new variant of SARS-CoV-2, we don't know. But I put this up to remind us that we shouldn't take any comfort in seeing our numbers come down because again, these countries, there were virtually no cases, no deaths in the summertime. So again, it's an evolving pandemic. This is the pattern in the US. It looks much more like the world than it does the European countries. But again, if you think about our geography, that's not surprising. A spike in the spring, the second hump in the summertime, and then an increase in the fall and winter. And while again, it appears to be leveling off, there's nothing to take any comfort from that because again, it looks like we're looking at a cyclical kind of thing. In terms of total deaths, the US has had 374,000 deaths, 5.7% increase. So we've seen a greater increase this week than the world overall. And by the way, if you look, you can sort of see that we're growing at about a steady rate and then it's sort of inflected up there. In terms of the week-to-week increase, it had been coming down and now is at 5.7%. And if that rate continues, we'll get to 500,000 deaths just in about 4 weeks. So again, a very serious, ongoing, evolving pandemic. In terms of where in the country these deaths are, this is the deaths per million for all the states. For those of you who've been following it, you'll remember early on the Dakotas were at the very bottom and now they're in the top 10. There's Tennessee with over 1,000 deaths per million. If we were to compare Tennessee to all the countries in the world, we would be a top 10 country in terms of deaths per million. The CDC has just come out with a report on something we have been talking about in this forum since October, and that is that COVID-19 is the third leading cause of death in the United States over the past 12 months. This is where cases have been in terms of infections per million. We see this, we see this sort of clustering here east of the Rockies, and then a little bit over here. This is cumulative infections per 100,000 over time. Here's where they've been in the last 2 weeks. Again, this explosion in the Southwest, this middle America, and as always, Tennessee right there is having a significant number of cases. If we look at our region, 1,220 cases in the Ballot Health catchment area, 9.6% increase in the past week, more than double the global increase in the same week. And if this week-to-week rate continues, we will double our number of deaths by the first week of March. I want you to think about that. Twice as many deaths as we've already seen by the first week of March. Increase that by the number of hospitalizations, by the number of cases, and you realize we are not out of the woods by any means. We're fortunate that there have been vaccines approved, but they, as would have been expected, it's not unexpected. It's taking a while to get them out and get them to people. The pandemic continues to grow around the world, rapidly approaching 2 million deaths. European countries are among the most impacted. There appears to be a mutation, several mutations to SARS-CoV-2. The preliminary reports suggest it may be more communicable, more easy to spread, but it isn't clear yet if it's more or less lethal or whether it'll be controlled by the vaccine. Preliminary data suggests that it will, but we don't know yet. The US has now passed 1,000 deaths per million, with their cases growing everywhere in the country, especially in the Southwest and the Southeast. We're expected to hit 500,000 deaths by February 12th. And this week, the week-to-week growth rate in the US was a third higher overall than the rate in the world. In our region, Tennessee overall and the Appalachian Highlands continues to be one of the most heavily impacted areas in the US. We're expecting to double our deaths by March of 2021. And this week, the region's week-to-week growth rate is more than double the worldwide increase. So the pandemic is still evolving. It is still killing people. It is still putting people in the hospital. It is still a major challenge for all of us. And right now, even with the vaccines, we really have no choice but to continue doing the things that we know can work. Avoid unnecessary crowds. Please wear masks. Engage in social distancing, and that means greater distance, shorter time that you're close to people. Implement good hygiene anyway. Stay home if you're sick. Conduct better testing, contact tracing, quarantine, and isolation. Protect the elderly and those with chronic diseases. I'm often asked by people whether it's safe for them to do X or Y, and it's hard to answer because one of the most important things to understand is that you may be willing to take a risk, but if there's someone in your household or someone that you're around who would be at high risk, you're putting them at risk if you do something. So it's hard sometimes to answer those questions. So please protect those with the elderly and with chronic conditions. We've got to get back to treating each other with greater kindness and respect. The events this week tell us that when we approach each other with anger, disagreement, argumentation, we don't get anywhere. It doesn't accomplish anything. We need to return to a time when we follow the best science possible. Science is not perfect. We always learn more. There's always more to learn. But we've got to follow the science, because if we don't, we're doomed to continue this cycle. There's a great deal more information about SARS-CoV-2 and COVID-19 on the College of Public Health website. If you'd like to be added to our mailing list, please let Jan Stork know. As always, I'd like to thank Dara Young for editing, producing, and posting this video. I mentioned that I get a lot of questions. I'm actually very happy to answer those questions because they help me understand what issues are important to people. They also help me learn more. So if you have any questions, comments, concerns, criticisms, let me know. I look forward to hearing from you. And finally, since this is the first episode, first video this year, let me wish you all a very happy New Year.